Hello, this is Dr. Shemans talking to you about your sinus surgery which you're going to undergo. Elsewhere in this video series you'll see a description of the sinus surgery which is under question and which we're going to schedule you for a procedure. These procedures are done either in an ambulatory surgery setting or in the hospital in an ambulatory setting. Prior to the surgery, you will have a CAT scan done, and I or your surgeon will go over with you all of the surgery that is contemplated in terms of opening up your sinuses and dealing with the nasal septum. Now, turning our attention to the preparation for the surgery. 1 to 2 weeks before the surgery, you should have medical clearance if necessary done, which may or may not include a chest x-ray, EKG, blood work, as well as the clearance note from your internist. 5 to 7 days prior to the surgery, please stop all blood thinners such as Coumadin, warfarin, Eliquis. Any of those may cause bleeding during or after the surgery, and therefore most surgeons would request that you stop those medications prior. My own preference is 1 week prior, provided that your internist or cardiologist allows it. The night before the surgery, please nothing to eat or drink after midnight. You may take your blood pressure medication or your reflux medication with a sip of water the morning of the surgery. You'll be coming into the operating room area, and that's called the pre-op area. You'll be visited by the nurse who will go over your chart with you, making sure that all of the medical clearance, chest x-ray, EKG, blood work, everything else is on the chart and ready to go, making sure that there's no issues to be dealt with. She'll also review the consent with you. You'll then be visited by myself and then by the anesthesiologist. Any questions regarding anesthesia, please address these to the anesthesiologist. You may want to discuss with the anesthesiologist issues about nausea afterwards. Certainly if you've had this issue after prior surgery, please discuss this at length with the anesthesiologist. Following this, the operating room nurse will come and talk to you, and they'll go over the procedure itself again, and then they will escort you into the operating room where you will be comfortably arranged on the operating room table. Make sure you're comfortable before going off to sleep. The next thing you'll remember is waking up in the recovery room. Now, when you do wake up after sinus surgery by myself, you'll have packing in the nose, so you'll be breathing by your mouth. Please do not pull out the packing from your nose, otherwise you will have bleeding. Now, at the time of the surgery, I put in plastic splints, which will stay there for 3 weeks. We also use packing, which comes out the next day. So you'll be going home the day of the surgery. That's called ambulatory surgery. You'll be going home. That night, I recommend that you sleep on 2 or 3 pillows and that you put ice packs over your face like a raccoon eyes. A good idea is to take 2 plastic gloves, just like this, fill them with ice chips, tie them together, and then drape it over your face. If you don't want that, you can use the ice packs that you can purchase in any drugstore and apply that over your face. Buy 2 ice packs so you can put one on your face, one in the freezer, and then rotate them during the night. You'll be coming in to see me the next day, at which point I will remove the packing from your nose, and that should make you a lot more comfortable. You'll be staying in my office for approximately half an hour, and that is to ensure that you don't have any bleeding afterwards. Now, when you go home, you'll still have the plastic splints in place. You can't see them or feel them, but they are there. And the purpose of the plastic splints is to prevent any scar formation in this region right over here, because that would otherwise necessitate a secondary procedure to release that scar. And I have found over the past 35 years that leaving the splints in for 3 weeks prevents any scar formation or the need to return the patient to the operating room to release that scar tissue. Those plastic splints come out in the office just by cutting 1 stitch and they're removed. So for 3 weeks you'll be breathing largely by your mouth, somewhat from your nose, but you will not have any discomfort in your nose. Now you can expect to have discharge from the nose for the 3 weeks because that is normal. You can rinse with a sterile saline solution. There are many different varieties available in all of the drugstores, even supermarkets, that carry a sterile saline solution which you'll use and spray your nose. Following the removal of the splints after 3 weeks after the surgery, you'll be using a regular sinus rinse. Doesn't have to be sterile, but you'll be rinsing your nose 2 to 3 times a day. The one that I typically recommend is the sinus rinse by Neomed, which looks like this. And basically you mix it up, you put your head over the sink, and you rinse your nose 2 or 3 times a day for at least 1 month. Following this, we'll put you on some medicated sprays to use for another month. And by that means your sinuses will heal extremely well. We'll remove any crusts that are in your nose after 1 month. They should come out easily. Following that, you should be breathing much, much better. If you have any questions, please do not hesitate to call us at 212-472-8882 or visit us on the website nyheadandnecksurgery.com. That's nyheadandnecksurgery.com. Thank you very much for your attention and have a good day.